Hey guys, this is Dr. Samir Islam. I want to thank you for joining us tonight. So tonight we will talk about celiac disease and we'll discuss what are the symptoms of celiac disease and how does this manifest within the GI tract, and maybe not even in the GI tract as well. And so celiac disease can present in a lot of different ways. For some people, they can have gastrointestinal symptoms, and these include things such as diarrhea, constipation, bloating, nausea, vomiting, and stomach pains. And these symptoms may be all together or they may be separate. I've had plenty of patients who come to me who just have bloating alone. We diagnose them with celiac disease, or they may have a combination of constipation and diarrhea, maybe upset stomach as well, and we do testing for them and they end up having celiac disease. But the other difficult thing about celiac is that it can also present in a lot of non-GI ways. There are a lot of non-GI manifestations of celiac disease, including anemia or your blood count being low without any real cause. Mouth sores or ulcers can develop, which could be a sign of celiac disease. And patients who are young or maybe in the teenage years may present as either ADHD or ADD, or maybe even have depression, and that could be a sign of celiac disease as well. Abnormal liver enzymes, your liver enzymes could be elevated for an unknown reason, and this could be due to celiac disease. You can also have joint pain or brain fog, vitamin deficiencies, including vitamin D, iron, calcium, and vitamin B12. And also a skin rash can develop as well. These can be all non-GI manifestations of celiac disease. And this can make this more difficult to diagnose because a lot of people come to see a physician may be complaining of a joint pain or a skin rash, and celiac disease may not be the first thing that a physician may think about, but it's something to keep in mind because this is a common manifestation not in the GI tract of celiac disease. Now, when we have somebody who we think may have celiac, there are a lot of different ways that we can treat and diagnose these patients. And one of the best and easiest tests that we can do to at least screen our patients is to do a simple blood testing, checking for what's called a TTT, or a tissue transglutaminase. This is probably the most sensitive test for celiac disease, and if you don't have this test being positive, there's a good chance that you may not actually have celiac. Now, the caveat about this particular test is that you have to be on a gluten-rich diet, meaning if you are already on a gluten-free diet and you have this blood test done, you'll have a falsely negative blood test, meaning it'll show up as you don't have celiac, which will be a wrong diagnosis. You have to be on a gluten-rich diet and actually be tested for this to actually have a good accuracy for this. Now, if you're on a gluten-rich diet and you're negative for celiac, there's a very good chance you don't actually have celiac disease. Now, there's also genetic testing that we can do to see if you may be prone to having celiac disease as well. And so for those patients who we suspect may have celiac, but the TTG is negative, we can certainly do genetic testing, and if that comes back positive, you may have celiac. The important thing about the genetic testing is that this is a very definitive test to rule out celiac disease. And so, let's say for example you have somebody who may have some sort of gluten intolerance, or you don't feel good with gluten, and you want to be on a gluten-free diet, and you don't want to be on that gluten-rich diet to get an accurate TTT testing. One thing we can do is we can do genetic testing to see if you have celiac or not, because if it's negative, you have about a 99% chance of not having celiac disease. And it's a very good test to rule out celiac. And typically we do this for those patients who are not able to be on a gluten-rich diet or refuse to be on a gluten-rich diet in order for us to check a TTG. Now, another way we can confirm the diagnosis of celiac is to actually do what's called an upper endoscopy or an EGD and take physical biopsies of the small intestine. And this will allow us to see under a microscope if you have any damage within the small intestine from celiac disease. Typically, we'll do this in those patients who we need to confirm as actually having the diagnosis, whether they have positive blood testing or whether they may have any other indication that we may suspect that they may have celiac disease. And when we look at the specimen under the microscope, what we'll see is that we'll see a couple characteristics that are very positive for celiac, whether it's the loss of the villi, and this also allows us to see the damage that's going on with the celiac disease. And there are different degrees of damage we can find in patients who have celiac. So our small intestine normally have these villi, which are used to absorb various nutrients and vitamins and minerals. Now, when you have celiac disease, those villi are sheared off, so you don't have them anymore. So it's almost like having your fists. And so because of that, you have the inability to absorb those vitamins and nutrients and minerals, causing deficiencies in your blood count, vitamin D, B12, and items like that. And this is one way for us to confirm if you have celiac or not. So in the next coming lectures, we're going to be discussing the exact treatment for celiac disease, and also what is gluten intolerance and how it's different from celiac. So I'd encourage you to join me in the next couple of weeks. We'll be discussing more issues concerning celiac disease and also gluten tolerance.